My name is Samantha Engel, and I'm going to be looking at the CDC's RX Awareness Campaign. The campaign focuses on addressing the prescription opioid crisis taking place in the United States today. The RX Awareness Campaign, conducted by the Center for Disease Control and Prevention in 2017, addresses the health issue of prescription opioid abuse and overdose. The CDC states that every day more than 1,000 individuals are treated in emergency facilities for misusing prescription opioids. Statistics show that from the year 1999 to 2015, more than 183,000 individuals died in the U.S. alone from prescription opioid overdoses, and this number continues to increase at a dramatic and shocking rate. In conducting the RX Awareness Campaign, the CDC aimed to increase the awareness of prescription opioid abuse and overdose. Being the CDC's first ever prescription overdose prevention campaign, it focused on sharing evidence driven data and the true stories of individuals affected by the epidemic, with the overall goal of reducing and preventing opioid abuse. The campaign targets adults between the ages of 25 and 45 who have taken opioids at least once in their life. After conducting formative research and accumulating surveillance data, the CDC found that the population with the highest fatality rate due to prescription opioid overdose was non Hispanic white adults between the ages of 45 and 54. Evidence also showed the need for prevention messaging directed towards individuals between the ages of 25 and 35. The CDC utilized a mixed method designed to analyze the data and responses to interviews, surveys, and feelings towards messages. The campaign materials included emotional videos of individuals affected by the epidemic, real life stories, and quotes from the participants, social media ads, signs, and billboards, all emphasizing the severity and impact of the epidemic. All of the campaign materials strove to create an emotional reaction from viewers in a manner that was both relatable and empathetic. Here are a few examples of quotes and ads provided by the CDC. Overall, the content cultivated by the CDC was thorough and effective. However, rather than strictly focusing on an older demographic of participants, it would have been beneficial to gather testimonials from younger participants who have experienced misuse, addiction, and abuse of prescription opioids. The beginning stages of the campaign included formative and surveillance research. It then went on to utilize environmental scanning, literature review, social media assessment, focus groups, and in depth interviews. After gathering data by using these campaign strategies, the CDC launched a small scale pilot that ran for 14 weeks in 9 high-burden counties in the states of Oregon, Ohio, Rhode Island, and West Virginia, all of which are highly affected by prescription opioid overdose. The pilot allowed for the implementation of the RX Awareness Campaign and creative messaging materials to be tested on the basis of participant readiness and level of interest. By focusing on the locations containing high levels of opioid abuse, the campaign was able to shed light on the severity of the issue in a way that captured the attention of individuals who were unaware of the extent to which the prescription opioids impact lives. The CDC found that the campaign resulted in an increased awareness of the prescription opioid epidemic. Participants reported the campaign materials to be easily accessible, attention-grabbing, and relatable. Many participants reported feeling that they understood the severity of the epidemic but did not recognize it at a community level. Overall, the CDC achieved its primary goal of elevating awareness, knowledge, and the intention of the RX Awareness Campaign. The greatest lesson I learned while analyzing this campaign is the immense strength of incorporating real-life stories within a campaign. The RX Awareness Campaign integrated videos of individuals personally affected by the epidemic and received strong feedback from participants and respondents of the campaign. An adjustment I would make to the campaign would be to incorporate additional participant footage and testimonials of younger individuals affected by the epidemic in order to increase the campaign engagement from a younger demographic. Another lesson I learned was that of mixed methods. I learned that the mixed methods research entails conducting research involving collecting, analyzing, and integrating quantitative research in order to cultivate and process data and findings. By utilizing this method, one is able to accumulate as much data and information as possible from a variety of tactics and strategies in order to make the campaign content as dense and beneficial as possible.